The challenge with palliative care, and you're right, that many of us are going to want and need palliative care way further upstream than the end of life. And it's not so available outside of the hospital. So community-based palliative care, like what we provide here, is very rare. And we provide it in the context of a social service agency. So we have to collaborate with the medical parts of the team to provide the full service. Diane Meyer, who's a doctor in New York, who's the head of the Center to Advance Palliative Care in this country, when I was recently in Chicago, a mantra I walked away from that conference with was demand creates capacity. And that it is really not going to be until all of us understand a little more about what palliative care is, demand of our clinicians, our doctors, our healthcare systems, and the people who pay for our health care, that this has to be a service that's covered. It has to be education. It's a priority for all clinicians so that community-based palliative care can get bigger and bigger, so that when you're not in the hospital, you have access to these teams of people who will provide all these extra added layers of support that you need at any time of a serious illness. So we're on the brink. I hope, I have to believe that this change is going to happen, but just like all major political changes in our country, it's going to take all of us. You know, I have this fantasy of a March for Mortality on Washington where we all show up in the streets like we did in the 60s and say, we're not leaving until we all get palliative care when we want it and when